The Arizona Medical Association's Member Spotlight Series is generously sponsored by Abe Huerta from BOK Financial. Whether you are purchasing your first residence or transitioning into your next home, BOK Financial is committed to supporting you throughout your mortgage experience. Our physician loan program provides enhanced flexibility and premium benefits not typically available through conventional or jumbo financing options. Eligible clients may secure 0% down payment up to $1.5 million, 5% down payment up to $1.75 million, 10% down payment up to $2 million, or 15% down payment up to $2.25 million, all lender-paid private mortgage insurance. Additional program advantages include discounted rates, float-down options, flexible qualification guidelines, a 0.125% rate reduction with a BOKF account, and ACH autopay, and no processing and underwriting fees on future refinances or purchases. Our program is only applicable to primary residences, one-unit single-family homes, detached and attached, agency-eligible condos, and planned unit developments. BOK Financial is a trademark of BOKF NA, member FDIC, equal housing lender. Copyright 2026 BOKF NA, and MLS number 403501. All loans are subject to credit approval.
My name is Laura Mercer. I am a practicing obstetrician-gynecologist here in Arizona, mostly based out of Phoenix, though I also help cover in Nogales on the Mexico border and up on Navajo Nation. I always say that I got into medicine just because I liked people and I liked science. I started college as an engineering major and loved the intellectual challenges of the science, but I did not love the lack of human interaction that I experienced in most of my classes. And long story short, and 20 major changes later, I decided to go to medical school and have loved it. I started medical school not even really understanding that there were different kinds of doctors. I'm the first physician in my family, and this was just not something that was known to me until orientation. Everyone was like, what kind of doctor are you going to be? And I was like, oh, I thought I just signed up to be a doctor. Like, I didn't even know there were different specialties. And throughout medical school, got to know OBGYN, and I really feel like it chose me more than I chose it. So I actually started out in private practice when I finished my training and loved my patients, but didn't love the focus on making money. That was sort of distasteful, I think, at my core, which I can say now, reflecting back on it. I think at the time I didn't realize why I was feeling burnt out and frustrated all the time. And so I transitioned to working for community health centers. And that has been so rewarding in ways that I think medicine is supposed to be. There's so much burnout, so much burden, administratively, charting, prior auths, all the things that come along with it, that for me, being able to provide care to a population that genuinely needs it, brings in that secondary gain where I really feel like I'm making a difference, and that helps stave off the burnout for me. It helps to recharge my batteries in ways that, as much as I loved my patients in private practice, the private practice environment didn't allow me to really be that needed, service-oriented physician that I think I crave. Arizona has healthcare shortages across the board, across our state, in basically every field, every specialty. Other allied health professions also have those shortages, so nothing is unique there in Arizona. Like, that's well known, well established for a long time. But OBGYN is hit hard by that, and we have various areas of our state that are truly maternity deserts, or are on the verge of becoming maternity deserts. And it is through that lens that I really felt called to try to help where I could. There's a saying, and I have no idea who initially said it, but it was on the wall of my high school like student council classroom, and it was like, if not me, then who? And I guess that got internalized after seeing it every day for many years in high school. And I really felt like, hey, I have the ability to help here. It is not that different than some of the international work I had done earlier in my career in Central America and in Africa, where there is, I think it's actually really common still for medical students and trainees and others to really be lured into the opportunities of practicing international medicine and doing those medical mission trips. And what I realized is we really had those areas of need right in our own backyard here in Arizona. And so practicing at the border and on our Native American reservations is not unlike seeing some of those low resource areas where there's some creativity needed and the need to really work with others and figure out how are we going to cover this, how are we going to make sure there's systems in place for transports, and how do we meet the needs of our patient population. I think that being in medicine right now is so different than probably what it was 20 years ago or 30 years ago. And so a lot of my mentors practiced in what we sometimes joke was the heyday of medicine, where there wasn't the electronic medical record, there weren't as many administrative requirements that can be burdensome, but there was also a lot more respect probably that just was inherent by virtue of the fact that somebody had the title doctor. And I don't know that that's still the case anymore. And I suspect that a lot of the healthcare doubts, misinformation, and disinformation that we see is a big part of that. And so I think it puts physicians, nurses, and everybody in the healthcare arena in a place where we not only want to care for people, but we really have to go out of our way to make sure that we're really meeting patients where they're at, explaining things better, and really helping to make sure that patients feel like an engaged and valued partner in their health. And I try to practice along those lines through that shared decision-making model. It's really less even just shared. And for me, it's more about like, how do I make sure that my patient is making the decisions that she wants to make and feels empowered? Like, how do I support her based on all my years and years and years of medical training? How do I make sure she has what she needs to do what she wants? And on a bigger scale, I feel like that's what my participation in organized medicine, like the Arizona Medical Association, ArMA, and my specialty organization, which is the American College of Obstetricians and Gynecologists, I feel like my efforts there help me try to do all those same things that I would do with an individual patient, but on a population level. And the idea there is that we can make a bigger impact. In medicine, particularly at a community health center like where I practice, we think a lot about the social determinants of health. So all of the things that impact a person's life and influence their state of health or their ability to be healthy. Things like where they live, the available resources, food, water, shelter, the basic things, access to healthcare, of course. But really those social determinants of health are really more appropriately probably called political determinants of health, because these are things that shift based on whatever health policy might be in place in the community where somebody lives, and that often has to do with what legislation is being passed at the state level or at a more local level, city council and things like that. And I am so privileged to have been able to work with ArMA and ACOG and other organizations to really address a lot of those health policy changes that impact our patients on a day-to-day basis and impact our ability as physicians to take care of our patients.